iStock Audio. iStock Audio.
Hello, I wanted to talk to you today about conditions in your low back, which can cause low back pain with the sometimes associated pain down the buttock and leg, also referred to as sciatica. A lot of these conditions do involve wear and tear of the low back. And here is a model showing the low back here. And this is the front view. As I turn this, you'll see the side view of your spine. And it's made up of really several simple segments. The vertebral bodies, which are the rectangular pieces of bone. And then in between the bones are the discs, which are the shock absorbers or the cushions. And if we're trying to help you with your back pain, we may consider fusion or artificial disc replacement. That involves removing this disc and basically recreating a new cushion to help decrease back pain. That is something that we consider, and we may approach that area through a small incision by your abdomen, or we may actually come in from the back side of your back, more where the back muscles exist. Nevertheless, that's a common procedure we may do, is to remove that disc and either fuse it or replace it. A lot of these conditions can cause back pain only. Back pain from disc degeneration usually is pain worse with coughing, sneezing, riding in a car, sometimes leaning over to tie your shoelaces. That type of back pain we usually treat rather conservatively with medications, physical therapy, chiropractics, and sometimes surgery. Surgery for this condition, of course, is a last resort. There's a lot of things that come into play on whether your specialist or your surgeon may consider surgery with you. If that is considered, however, we typically look at performing either something called fusion or sometimes an artificial disc replacement. Both have a great success rate in the properly chosen patients. Most of the patients I see day in, day out probably are not the best candidates. There are good candidates for it. And again, I outlined some of the things that you might be yourself experiencing, which could be potential hints that you might be a good candidate for this. Other things in the back that are very common are what I call sciatica. And sciatica is a fancy word for pinched nerve. And that pinched nerve can be from a piece of disc, which again is, think of that as a piece of crab meat which can press on the nerve. Other things that can press on the nerve would be bone spurs. And a lot of us as we get older, in our 50s, 60s, and 70s, can get more bone spurring, which can cause the pinched nerve. Again, as you go through your treatment options, if you've exhausted some of the more mainstream therapies and you feel like you need to consider other options, then sometimes surgery is an option. And that would typically involve small incisions to unpinch the nerves, which again, if you look at the model, the nerves are in the canal. And typically we do small incisions to remove bone spurs, which can originate from the spine and press on the nerves. So common sense says, let's remove those bone spurs to take the pressure off the nerve, and usually with good success rate. Back surgery has a bad reputation, and for most people it's probably not the best course of action. But there's plenty of patients who do greatly benefit from small incision surgery to unpinch nerves and alleviate sciatica pain.
iStock